Good afternoon, professors and honorable audience. I'm Praewraphee Pulsawadkitikool, and I'm here to present to you a retrospective study of endodontic errors during nighttime rotary mechanical instrumentation and root canal obturation process performed by dental students. The evaluation of procedural errors of endodontic treatment is important. From the previous study of Valencia University of Medical and Dental School in 2008 to 2009, the study has evaluated the quality of root canal filling by undergraduate students using nickel titanium rotary files or manual instrumentation in laboratory. And the results shows that the percentage of technical success was 44%. From previous study in India, Savita Dental College and Hospitals also study on the quality of root canal filling performed by undergraduate students. The result shows that the percentage of adequate length was 89%, and the density of root canal filling shows a low percentage of 34% of the teeth. These pieces of evidence imply that the quality of root canal filling performed by the undergraduate students are varies. In general, conventional stainless steel hand files were the standard equipment for the mechanical instrument that was primarily taught to undergraduate students. And however, the stiffness of stainless steel file may lead to procedural errors such as ledging, zipping, and perforation. And currently, nighttime rotary instruments are being widely developed due to their efficacy. Root canal shaping by nighttime rotary instrument is mainly used since it can maintain flexibility, increases the taper of the canal, good centering ability, diminish debris exclusion, and allows for less preparation time. And nowadays, there are many trends that nighttime rotary technique is started to teach at the undergraduate level in dental schools. In 13 or 16 dental schools in France, students could use rotary nighttime techniques for canal preparation under the supervision. And now France and Jordan announced a consensus on the need for rotary devices to be used in undergraduate education. And currently, Thailand has no consensus in teaching rotary instruments in undergraduate students. And therefore, the techniques and instruments being used in endodontic treatment for the mechanical instrumentation process are diverse. And there are several studies on the success rate of endodontic treatment in Thailand. First, in 2019, the Rotary University has evaluated success and failure rates of endodontic treatment performed by dental students of 19 teeth, and it had encountered the following complications, such 17 root perforations, 1 ledge, and 1 transportation. The success rate for teeth with complication was 68.4%. And second, Mahidol University reported that the presence of the underfilling in the treatment period had a negative effect on the treatment outcomes. And the result is related to from the study from Khon University, which revealed that the quality of root canal filling significantly influenced treatment outcomes. And however, stainless steel hand files was used in previous studies has been mentioned. The fact from the previous studies in Thailand, dental students did not employ the nighttime rotary instrument, and there has been no study conducted in Thailand that focuses on the procedural errors performed by dental students using rotary instruments in the clinical level before. So here comes our objective is to evaluate the procedural errors of endodontic treatment that occur during mechanical instrumentation and root canal obturation process performed by dental students using rotary instruments. The protocol was approved by the RSU-ERB Research Ethics Committee on March 19, 2020. The dental charts records which have completed endodontic treatment were mainly collected by undergraduate students, and the digital periapical radiographs were collected between 2014 and 2019 to record and evaluated the procedural errors and the density of root canal filling, and is supervised by endodontists. Inclusion and exclusion criteria are as shown on the screen. The criteria to evaluate the quality of root canal filling material has been modified from the study of Praewraphee et al. In 2004 and Kabas et al. In 2010. The categorical data were described as a frequency and percentage of the types of the tooth, position of the tooth, age, gender, and procedural errors. The ratio of teeth position and procedural errors were calculated with features exact test, with a statistical significance for sets at 0.05. A total of 379 teeth had undergone complete endodontic treatment with undergraduate students by using Rotary instrument between the 2014 and 2019. 258 teeth were included in the analysis. The sample size consisted of 113 males and 145 females, which is 44% and 56% respectively. The age of the sample ranged from 14 years to 80 years. The mean age was 42.5 and standard deviation was 15.7. The sample included 83 anterior teeth and 175 posterior teeth, which were calculated as 32% and 68% respectively. The types of the tooth were 83 incisor and canine teeth as 31.78%, 73 premolar teeth as 28.29%, and 102 molar teeth as 39.93%. The prevalence of overall procedural errors was 31.78%. The numbers of overall procedural errors defined by the types of the teeth were 16 incisor and canine teeth, 24 premolar teeth, and 42 molar teeth, while these prevalence were 6.2%, 9.3%, and 16.28% respectively. In terms of anterior position, there were 83 root canals. The prevalence of void detected, underfill and overfill root canal filling, and ledge formation were 4.82%, 2.41%, 4.82%, and 7.23% respectively. For the posterior position, there were 444 root canals. Posterior teeth exhibited the prevalence of void detected, underfill and overfill root canal filling, fracture instrument, perforation, and ledge formation were 9.46%, 4.05%, 3.15%, 1.13%, 1.58%, and 6.31% respectively. The ratio of procedural errors between anterior and posterior teeth was seen in the table. The procedural errors were found mostly in posterior teeth than in anterior teeth, and however, there were no significant differences between tooth position and all procedural errors. Now let's move to the discussion part. In the present study, the prevalence of overall procedural errors was 31.78%, which is similar to the previous study. For students in Pakistan, Yusuf Khan and Mehdi 2015, the prevalence of total procedural errors was 32.8%. A previous study has demonstrated that the procedural errors occur more frequently in posterior teeth rather than in anterior teeth, which is similar to the present study. In this study, the prevalence of procedural error were found mostly in posterior teeth than in anterior teeth, as 25.58% and 6.2% respectively. This result may be related to anatomical complexity of posterior teeth that is greater than anterior teeth, and besides, the undergraduate students have inadequate clinical skills and experience, so they may find it difficult to access teeth in the posterior region and to manipulate multiple root canals. The major error in this study was void occurring in root canal filling, which account for 16.69%. Hill-Basar et al. In 2017 has concluded that the periapical health was associated with adequate root canal obturation. Although the present study did not determine the success rate of the endodontic treatment, this issue should be concerned and should be further investigation. One of the procedural errors in this study was overfill root canal filling. The percentage detected at the anterior teeth was 4.82% and in the posterior teeth is 3.15%. Kerikis and Kronstadt in 1979 has found that overfilling leads to failure and has been shown to reduce the success rate to low as 76%. And as a result, both the clinician and undergraduate students should be aware of overfilling, which may lead to the decrease in success rate. And there are many reasons why the failure occurred in the overfill root canal. For example, it may be a lack of awareness of working length, over-instrumentation, or errors in obturation technique. In the present study, the percentage of ledge was 7.33% and the fracture instrument was only 1.13%. In the author's point of view, the numbers shows a small percentage, so this can be concluded that the use of Niti rotary instrument is safe under the supervision of the endodontist. The advantage of shaping of root canal with Niti rotary files has been broadly reported. The implementation of rotary instruments with Niti provides well taper of root canal preparations, minimizing the risk of root canal transportation, provide the good centering ability of root canal shape, meaning the canal curvature, and reduce the risk of procedural errors. The ESE has recently published the article to guide the endodontics undergraduate curriculum to develop the theoretical and clinical training of dental premolar and molar teeth, which undergraduate students must undergo preclinical and clinical practices. And recently, there are many traits of Niti rotary techniques being taught at the undergraduate level in dental schools, with a document of the clinical performance of Niti file used by the undergraduate students showing up. And interestingly, nowadays, based on available evidence, dental school programs in Thailand provide Niti rotary instrument only in laboratory practice. And moreover, the College of Dental Medicine at Bangsit University has allowed undergraduate students to be used Niti rotary instrument on their patients since 2009, while other institutions have not allowed using Niti rotary instruments in the clinical practice. From the present data, we can imply that Niti rotary instrument is safe to be used by undergraduate dental students under the supervision of an endodontist, and the data of procedural errors could be a benefit for improving both preclinical and clinical curriculums. And besides, the present study could be a novel evidence base for consideration of using Niti rotary instrument in the clinical practice in Thai dental students. In limitation of this study, the prevalence of overall procedural error rate was 31.78%, and the procedural errors were found mostly in posterior teeth than in anterior teeth. And however, there was no significant difference between position and all procedural errors. The majority of these errors happened during the root canal obturation process. And finally, further improvement of obturation technique is needed in clinical undergraduate training. Thank you. ขอบคุณค่ะ
Okay, thank you very much, Ms. Praewraphee, for your presentation. Does anyone have any questions?
There is a question from the chat box from Ms. Tananya Momin. She asks that, why is the fracture instrument not found in anterior teeth?
We primarily examine from a dental chart record. If the fracture instrument occurs, the supervisor will be notified in that visit and will make every effort to remove the fracture instrument during the visit. And some people did not record it on the record.
Okay, another question from chat box.
Can you hear me? You can see at the chat box. Can you hear me? Okay. Kun Chutimon Nanarong asks, assume that a hand file and rotary are being used in a case. In the data still used, how can you tell whether a hand file is being used?
In that case, it will be eliminated based on the exclusion criteria at first, and all information are obtained from the treatment record. Thank you.
Okay, I have one question. In this study, do you think why is the overfill occur in the posterior teeth more than the anterior teeth?
And to use nighttime rotary instrument effectively, skill and experience is needed to be able to control the rotary instrument to be properly in the root canal. In addition of the position of the tooth, undergraduate students may find it difficult to access the teeth in the posterior region and result in an overfilling of root canal filling material. Thank you.
Okay, thank you. Any question? Okay, thank you for a nice presentation, and I hope that this topic today is helpful and a good information for the audience.